This is AnnaMama, a pediatrician, and today we will discuss the outbreak of botulism in several cities in Russia. Most likely in this case we are dealing with foodborne botulism, where the source of botulism is canned salads and other preserves, presumably beans. What is important to know? Clostridium botulinum bacteria exist in dust and dirt as harmless spores, but in the absence of oxygen, these bacteria produce botulinum toxin, which then becomes dangerous. As you know, it leads to muscle paralysis. The main danger of botulism is that important muscles, such as the diaphragm, which is responsible for breathing, can be affected. By the way, the highest level of foodborne botulism in the world is in Georgia. So, the most common source of botulism is homemade preserves. For example, mushroom, vegetable, and fruit preserves, such as canned beans, corn, and peppers. These are preserves without the necessary thermal processing, that is, heating to 120 degrees for 5 minutes. This destroys the spores and makes the preserves safe. You probably still remember the restrictions on honey and corn syrup for children under 1 year old. So, these restrictions are also related to botulinum toxin because the intestines of children under 1 year old are different from those of adults and cannot destroy the spores of these bacteria, which can enter the child's body along with honey. And then the spores inside will start to multiply and produce botulinum toxin. Therefore, do not give honey and corn syrup to children under 1 year old. That was a small digression about children under 1 year old. What are the manifestations of botulism? These are paralysis, muscle weakness, intestinal symptoms, and vision impairment. They appear approximately 1-2 days after the spores enter the body, and these symptoms can last for several months. There is usually no fever, blood pressure and heart rhythm are normal, and a mild course of the disease appears as abdominal pain, nausea, diarrhea, vomiting, dry mouth, and dry mucous membranes. This is very pronounced dryness, and patients directly complain about it. Vision impairment in the form of blurred vision, double vision, and other visual changes. Severe infection is accompanied by speech impairment, shortness of breath, difficulty swallowing, muscle weakness in the arms and legs, and in infants, it manifests with constipation, difficulty feeding, and a weak cry. Symptoms vary slightly among individuals. Diagnosis involves detecting the toxin or the growth of Clostridium botulinum in serum, stool, and vomit. Differential diagnosis is, of course, conducted with neuroinfections, myopathies, Guillain-Barré syndrome, Lyme disease, encephalitis, stroke, and other diseases that may have similar courses. Treatment involves hospitalization and the administration of antitoxin promptly. This is the main antidote, our primary countermeasure. It prevents further paralysis but does not eliminate the already existing symptoms and clinical picture. Intensive therapy is also carried out in cases of paralysis, and intubation is performed if there is respiratory failure. Some cleansing enemas or laxative enemas may also be prescribed. Antibiotics are generally not needed, except in cases where botulism is caused by spores entering a wound. This type of botulism also exists. After the illness, physical therapy is necessary to restore muscle strength following paralysis. Prevention, and this is the main thing you must remember. Proper canning to destroy the spores, a temperature of 120 degrees for at least 5 minutes. I have already mentioned this. Children under 1 year old should not have honey or corn syrup. If you have a deep wound where there is no oxygen, be sure to see a doctor with such a wound and do not eat canned goods with a bulging lid. If you have homemade preserves at home, it is better to protect yourself with additional heat treatment and do not store ready-to-eat foods outside the refrigerator for more than 4 hours. This will protect you. The prognosis is generally good with timely medical attention. Most people make a full recovery, and the mortality rate among children with timely treatment is less than 1%. If you suspect botulism, urgently consult a doctor immediately and be sure to monitor the food you consume and give to children. Take care of yourselves. This was AnnaMama, pediatrician and candidate of medical sciences. Stay with me on the channel. Thank you for watching.